All right. So maybe we can start with maybe you giving a little intro and then we can jump into the questions. Does that sound good?
Yeah, for
All right.
sure. My name is Dr. Molly Johannessen. I am the Director of Education and Teaching at UMHS, which means that I oversee a couple different things. I oversee academic support of students, especially when they get to studying for step one as well as step two. And I have my hands a little bit in faculty development. So that's kind of where the teaching comes into play. But I'm also the course director for biological basis of clinical medicine, which is the course that students take in Maine that consists of the Kaplan review components. And so I helped to develop the integrated course as it is now, and help support students as they go through that course. And I teach the physiology component of that course.
All right. So in, I guess, general terms and some specifics, what is the main semester?
Yeah. So when you're in St. Kitts, you are focused mainly on basic sciences, which is critically important to your role as a physician. But what comes after that is clinical sciences and the application of your knowledge in basic sciences to the healthcare of patients. And so what we do in Maine is transition you from basic science and focusing on the basic science topics into the clinical aspect. And you do a little bit of that in St. Kitts, the physical diagnosis course, the ICM-1, but the main semester really caps on top of that. And so you take what's called ICM-2, which is the equivalent of that next layer to intro to clinical medicine, where you are responsible for history and physical of patients and beginning stages of starting to ask those questions, make a beginning picture of the differential diagnoses, and start thinking about what tests you might run, what evidence you need in order to begin to work with a patient. And at the same time, you are preparing for the USMLE Step 1 exam. And that Step 1 exam is a exam that tests your basic science understanding of clinical vignettes or clinical patients, if you will. And it's a 280 question exam where you read and you answer a question that involves a clinical vignette, and the question itself, you interpret the clinical vignette, and then the question itself is your basic science understanding behind that. What's the reason for it? Why are they presenting with X, Y, or Z? And so the other portion of Maine is preparing for step one. And so what we do is we review that basic science material connected to and aligned with the clinical application of that material. So while students are going through intro to clinical medicine, they are also spending time in what we call the Kaplan course, reviewing the basic science material. Now, I emphasize review because it really truly is a review, right? You have to have the baseline knowledge having taken those courses in St. Kitts, and that's where the initial knowledge comes from. So everything we teach in the Kaplan course, you've learned before. So this is the review to it and saying, okay, how does it go with the clinical presentation of a given system of the body, for example?
Right. So my next question was going to be, what is the Kaplan course? And I know you kind of covered that in its piece in the main semester. And I think you actually fully answered the question that it's just a review course. It's everything we've already seen before. And it's, when I took it in Maine, it was really well incorporated into there. Could you talk more about why we've started to have it more incorporated into the course?
Yeah, for sure. So a couple of things drove this change, this integration. The first was that the USMLE Step 1 exam became more clinical. And it became more clinical for a number of different reasons. The whole purpose of the STEP exam, and I'm going to walk through step 1, then step 2, and step 3, is As a clinician, your job is to interpret signs and symptoms from the history, from the physical exam that you pull out of a patient, and that you know enough about the basic sciences, that you know why they present with X, Y, and Z, and you know what tests you should run, what evidence you're going to gather in order to verify an individual diagnosis and begin on the clinical care. And when you graduate, you are technically able to do all of that on your own as a resident. But then step 3 says, okay, can you do it without an attending? Right? So the step exams really assess those layers. Step 1 is, can you gather the information from signs and symptoms of a patient? And do you know enough about the basic science to explain why those signs and symptoms exist? Okay, so that's where step 1 comes in. Step 2 is, okay, well, what tests do you need to run? What results are you looking for? What's the first steps of clinical care? How would you initially begin to manage your patient, right? Now, before you go on to clinical rotations, you need to know that you know enough about that basic sciences to be a part of that clinical care team. And that's step 1, right? Well, a huge part of what I just talked about was the clinical example of it, right? Interpreting signs and symptoms, understanding what a patient is presenting with. And we do a little bit of that in St. Kitts to say, okay, physical diagnosis, let's take anatomy at the same time. Let's incorporate some clinical aspects into physiology and into biochemistry and into neuroscience. And in your final semester, you do quite a bit of that with PharM and PATH and ICM-1, but we never really put all of the basic sciences with those clinical systems of the body together as one. Okay. And so our students struggled with recognizing those clinical signs and symptoms and connecting the dots with the basic sciences. Mm-hmm. Now, in full disclosure, students all over the world struggle with this. It's the most difficult thing to do as a medical student, is to say, okay, I know a lot about anatomy, but what does that mean for my patient? I know a lot about biochemistry or genetics, but what does that mean for this patient who's right here? There are curricula around the world that have been developed around that, right? And ours is very strong in the basic sciences, but we needed that opportunity to say, okay, how does the physiology present for the cardiovascular system in a disease or in a MI? Yep. What do we anticipate is going to happen to your cardiac cycle? What do we anticipate is going to change in terms of your blood pressure? Why do those two things go hand in hand? And so that's the design of this semester. You start with a couple of weeks of basic science review. Okay, so you spend a whole week on physiology and then a couple of days on PharM to set you up for the pharmacokinetics, the pharmacodynamics, and autonomic nervous system PharM, which is super complicated but yet high yield and covers the whole system of the whole body, right? And then you do a couple of days on PATH and the intro to PATH, right? And we do a couple of days on behavioral as well. And then you go into the systems of the body and you cover 9 systems of the body. Cover respiratory, cardiovascular, GI, neuro, musculoskeletal, renal repro, hemononc, and then endocrine. Okay. So puts them all together and you cover all the systems of the body. But every week you start your week with the basic sciences. So we do a little Kaplan. And then we do a clinical on top of that. So we'll do a little bit of that all in one day. And then for the rest of the week, you work on understanding what you're gathering from a history and physical. Okay. So you do that in a small group. Then you practice it one-on-one with a standardized patient, and you start to get better and better at that. And then at the end of the week, we pull it full circle and we say, okay, how would that system present itself on the step exam? We do a practice session, basically where you work in small group and we do multiple choice questions. Now, because Kaplan is who we partner with, Kaplan teaches the lectures that are basic sciences, and we use the Kaplan Q bank at the end of that week. Now, One of the values of having someone else teach the basic sciences is you hear it from another set of words.
Yes.
You hear somebody else give you their emphasis on it, right? And the job of Kaplan, really their entire goal that they've had since 1939 when they started, was to prepare students for standardized exams. So it's all about review, right? It's not in any way, shape, or form to step on who's taught you it to begin with, but to give you another perspective, right? Furthermore, the Kaplan Q Bank is very detail oriented, right? They're going to give you all of the signs and symptoms that may present with a patient. And so, although there are other Q banks which are phenomenal and will really prepare you for the STEP exam, the Kaplan Q bank allows for you to really hone in on those details. And then we can add on top of that later. We can come back to AMBOSS, which you hopefully have used in your basic sciences, but then we can add on top of that UWorld and NBME practice exams and what we can maybe sometimes call the COMP or the Comprehensive Basic Science Exam, the CBSE. We add that later on after you've perfected this foundation of details. So that's what happens in.
Okay, great. So the next question we've already touched on a little bit, but we've talked about what step one consists of. So it's 280 questions, integrated basic sciences and clinical together. But when does the prep for that start? And is there anything students should do while they're in St. Kitts to prepare for Maine and then further for STEP?
So that's a difficult question because, and I'm going to change the word should to
Okay.
could. Okay. And I'll explain why I'm going to change that word should to could. Because there's obviously a should, but every student is different, right? And so some students really struggle simply to make sure that they're getting the knowledge that's occurring in St. Kitts. And if that is the case, we don't want to say add on top of this STEP prep, right? Now, if you are at a place where you're doing okay and you can start to push yourself, absolutely, we would totally encourage you to do so. Semester one, probably don't have enough knowledge yet to start to study for STEP.
Yeah.
Semester 3 to 4 is usually where we start to say, okay, so here's how you could add in some STEP preparation. As we already talked about, clinical vignettes are the basis of these questions, right? So in neuroscience, in physiology, in pharmacology, in pathology, in micro, you have associated with those courses clinical aspects, a little bit of components of ICM. Those are clinical vignettes. Those are the diseases that your patients are going to present with. Now, your job, and really truly, you will be STEP prepping if you ask the question, okay, so you present with X, Y, and Z. Where's the micro in that? Where's the phys in that? What's the reason for why this is being taught at the same time as this unit in neuro? And that's just a level of you studying, right? That doesn't add any additional resources. That's you asking these questions of like, okay, so how would this present itself potentially on the STEP? And if you can begin to start to ask those questions and go to the ICM faculty, go to the micro faculty or the neuro faculty and say, can you help me put this together? They all know that the reason they're teaching this material is because it's going to prepare you for what comes next, right? And that you're preparing to become a clinician, especially those who are clinicians are thinking about it from a clinical perspective, right? And they give you examples in class of a clinical disease. That's the gold. That's the gold right there, right? Because now you can say, okay, well, how would this maybe show up on a standardized exam question? The next layer, and this is the layer that kind of sometimes starts to overwhelm students, is, okay, so how does it show up on a standardized exam question, right? And part of the reason why we give you the opportunity to opt in to the Kaplan resources, but we also have the option to enroll and utilize the AMBOSS resources is those are the example of the STEP questions and the standardized exam questions. Now, should you go into the Kaplan Q Bank or the AMBOSS Q Bank and do willy-nilly any mixed set of questions? If I was you, I would not. And the reason is you're going to get a lot of them wrong, right? Because we don't know how everything fits together yet. But if you're in the middle of phys and you are, let's say, Dr. Nagapa is talking about the renal system, or maybe Dr. Gigi, I think she taught the renal system, but nonetheless, if you're on that area, well, then go into your Q bank and click, I want to do physiology questions, and it can be AMBOSS or Kaplan, doesn't matter. I'm going to click physiology and I'm going to click renal. And maybe I'm even going to dive down even deeper. Maybe it's that I want to do acid-base questions in the renal system. And in both areas, Kaplan as well as AMBOSS, you can get to that level. Now, it's not going to be a ton of questions. We're not talking about doing a ton of questions. We're talking like maybe 10, 15 questions a week. Maybe you up that as you get into EBS 4 and into EBS 5, maybe doing 20, 25 questions a week, but do it on the material that you're covering at that time so that you're making relevant what it is that you're learning in your classes, right? And you're going to find that, in fact, your faculty already do this. Your exam questions are already quite step relevant, but we don't necessarily trust that until we see it elsewhere, right? That in fact, a lot of what you're doing already is step prep, right? But you got to challenge yourself to think about, if ICM and Pharm were to write an exam together, how do I study for that? If ICM and Phys were to write an exam together, how do I study for that? And that is the piece we don't have in basic sciences. So that's the little piece that you push yourself on.
Okay. So now jumping back to Maine, and another part of getting ready for Maine is, what are the time frames? One, for leaving the island and moving all the way up there, to the time frame within the Maine semester, what's going on, the weeks, months, and then after Maine, getting ready for STEP.
Yeah. So in terms of, if we do it directly and we don't take any breaks, as in like a semester off between the island and Maine, you leave the island at the end of your EBS 5 and you have that same break between semesters as you've had between every other semester in order to move from St. Kitts to Maine. Okay. We start the Maine semester on Monday of the first week of the semester, all right? If you're hearing rumors that you had to be there early and all kinds of stuff, you're right. During COVID, we did. We needed you there early enough that you could take all the tests, that we could make sure that everybody quarantined. So you're right. There was some times where that was the case. It's not the case anymore. And hopefully, knock on some wood, if we can all keep ourselves safe, and the world keeps itself safe, we won't go back to that, right? So, but we do start right on that first Monday of the semester. And we start with really just one day of orientation, and then we dive in. And we dive into physiology for the first week, and then Kaplan style lectures for the whole next week, Pharm and Path, and we go into behavioral sciences and about the next half of the next week. So it's about 3 weeks of getting you ready for the rest of the components of the semester, okay? And you'll take a diagnostic exam, which is an 8-hour assessment, very similar to step 1, where we want to say, okay, now that you're done with basic sciences, now that you're really deeply, intentively preparing for the step exam, I call the Maine semester your first pass of the material, right? If you've been studying and preparing along, that's perfect, that's wonderful. But now we're reviewing it for the first time. We're going to have undoubtedly a second pass, potentially a third pass, depending on how many times we need to go through this material to get ourselves to the place where we are predictively ready for the step exam. And I'm sure there are questions on that. We will get to that, so I won't go into that. But then you dive into the systems, right? So weeks 4 through 12 are systems of the body. Okay, so each of those are, as I described them, you start with basic science, clinical, you spend some time working on the history and physical, working with standardized patients, and then you come back and put that into practice at the end of the week through some practice questions and a quiz to make sure that we're doing questions and staying up to date on that material. And then In the last week, you do some final exams. In the middle, there's a midterm exam, a final exam at the end, an OSCE, where you demonstrate your performance on history and physical. And then we have 2 more weeks of Kaplan style lectures. There's a couple topics we haven't covered yet at that point. Microbiology, immunology, and biochemistry are the 2 major ones. So you spend a whole week on biochemistry, you spend about a half a week on micro and immunology, and then just a little bit of pharm at the very end to kind of capstone everything. And a couple times at the beginning of the semester and the end, you'll have some integrated sessions with multiple Kaplan faculty together at once who will kind of go through some practice questions with you. And then you have a week to study, and then you take what we call the qualifying exam. And the qualifying exam is very similar to the diagnostic. It's 8 hours, it's 280 questions, taken over 7 blocks, just like the STEP exam. And the end of the Kaplan course, or the biological basis of clinical medicine, you must achieve a score on that exam in order to qualify to take the STEP exam. And that score is such that you're ready. You're not entirely ready. You're not all the way to the STEP exam, but you're ready for your next pass of the material, right? And so we keep it just a little bit below where actually ready for the STEP exam might be, simply because we want it to be kind of a stepping stone and keep pushing you in that direction. Now, after the main semester, so the main semester itself is the same length as all the semesters in St. Kitts. It's 15 weeks long. And so that's what you'll look for in terms of living in Maine and existing in Maine. After that semester, you transition into what we call a dedicated study period for the STEP 1 exam. You cannot go on to your clinical rotations until you pass the STEP 1 exam. And the reason is, back to kind of something I said earlier, you need to demonstrate that you can gather those signs and symptoms, the history and the physical, and know enough about the basic science behind why they're presenting that way, that the attendings trust that you can do that all on your own, right? So that's what you're going to do in your clinical rotations. And until we're ready and demonstrate that, we can't really go on to that next layer of it, right? So that's what step 1 does for you. And so we don't go on to anything until we pass step 1. And that timeline for how long it takes you to study for step 1 really, truly depends on you. And it depends on a couple of different things. One, were we able to begin incorporating the clinical aspect and the basic sciences when we were in St. Kitts, right? Again, like I said, some students really struggle just with those baselines. That's okay. They're going to spend longer later to study for step 1. Did you use your time in Maine to really integrate them? Did you learn how to learn from multiple choice questions? Did you learn the details in learning from the Kaplan Cubic, right? Or did you spend more of your time on ICM? Some students do, for positive and negative. Some students need to, because they need to boost their skills, their history and physical skills. Some students choose to lean on that because that's the fun stuff. And of course it's the fun stuff. That's what you want to do, right? But the more you can think about the basic science behind it, or how it's going to be assessed on these standardized exams every day, the less you have to do at the end, right? So your timeline gets a little bit faster. And so depending on where we are in terms of our readiness at the end of the semester, your timeline to take the STEP exam is typically around 4 to 6 months. That's where most students take the STEP exam. Some students become delayed either because they have to take the Kaplan qualifying exam a number of times, and that exam is offered once a month, so you keep preparing for it, you keep aiming to try to achieve that qualifying score. And some students struggle because, truthfully, the number one struggle is when you leave Maine, and most students will leave Maine when they are done with the semester, real life exists.
Yep.
And you've been living in kind of a UMHS bubble since you started. Although life has been happening, and I'm sure that we know things that are going on outside of it. And some of us have, pulled people into our bubble, and sometimes that's good, and sometimes that's not so good. But all of a sudden, you don't have this structure of the institutional timeline. And so in many cases, it's that distraction that leads to the delay in the timeline. And so some students take closer to a year. Institutional policy indicates that you have up to 18 months to take and pass the STEP exam. Now, if you fail the qualifying exam, so the Kaplan exam, you have as many chances as you need within 6 months to pass that. Okay. During that 6 months, you will work with Dr. Michaud, the learning specialist in Maine, to continue to study for that assessment. And you'll talk about things like, are there other reviews? Do you maybe need to think about a tutor? What are our areas? Is it test anxiety? Is it fear of taking this test? And what are those kind of areas of struggle that we're trying to overcome? And you'll continue to improve that. Now, that 6 months can become longer if necessary. If you and Dr. Michaud agree that you need some additional time and you're continuing to work directly with him during that time. Once you pass the Kaplan qualifying exam, you then work with me to study for the STEP exam. And no matter what, during both of those timelines, there's an expectation that you will check in with us, let us know how things are going. We'll give you some ideas of some good ways to do that. I always say assessments are the best driver. They're your evidence of where you are. And if you can commit to taking assessments, A, you're staying with your study plan. B, you have something to tell me about. And I'm going to want you to tell me about something. So that gives you some very opportunity to do that. And so that usually, for most students, as I mentioned, that lasts about 4 to 6 months before you'll take and pass that STEP exam. 4 months is ideal. So the more you do in St. Kitts and the more prepared you are, or are able to do in St. Kitts, I should say, and are able to then add that really STEP studying before you even get to Maine, and then during the Maine semester, the better prepared you are when you leave the Maine semester, and the less time you'll take to study for the STEP 1 exam.
So we've talked a lot about the Kaplan exam, both the diagnostic and then the one that can determine, am I ready to move on to looking at a STEP date? What is the comp NBME exam? We haven't talked about that yet.
Yeah. So many students at other institutions call it the comp. Okay. We call it the CBSE, and I'll let me define what that means. CBSE stands for Comprehensive Basic Science Exam. Okay. Now, NBME is an organization, the National Board of Medical Examiners is an organization who writes the USMLE, or the United States Medical Licensing Exam. That's what USMLE stands for. And they are an organization who also wants to help you prepare for the USMLE, right? It's in their best interest for you to pass the USMLE and therefore be able to go on as a practicing physician, eventually passing all of them. And so one of the things that they release are practice assessments. And they release some that you can do on your own. We call them self-assessments. And so they are comprehensive basic science self-assessments, or technically CBSSAs. You'll hear your classmates refer to them affectionately as the NBMEs. And then there is a version of that practice assessment that we as an institution can purchase for you. Now, many institutions use that as their qualifier exam. Okay. In order to qualify to take the STEP exam, that's the exam that you have to get a certain score on. At this point, we do not use it as a qualifier. We still may in the future, but right now we do not. Right now, we only use the Kaplan exam as a qualifier, but we do require that you take this exam. Now, let me tell you about the exam, and let me tell you the conditions under which we require that you take them and why they're good for your preparation. Okay. So you will take the USMLE Step 1 exam at a testing center, Prometric, same testing center that you took the MCAT exam at, or if you didn't take the MCAT exam, maybe you took the ACT or the SAT. It's a testing center, and that testing center isn't like hanging out at your home. They have metal detectors that you go through to go into the room and out of the room. Other people are usually there. You usually are sitting in a cubicle taking this exam. So it can be in Puerto Rico, the power goes out almost every day, and or it's freezing cold in there. One or the other seems to be what happens every time anybody takes an exam there. There are other places the power goes out, but it just seems like it frequently occurs. As those of you who are from Puerto Rico know, power goes out everywhere in Puerto Rico. It feels like every day. So having the practice in that environment is a critical component. NBME used to, during the pandemic, allow for us to offer the Comprehensive Basic Science Exam, or the CBSE, remotely. So there are a number of students who previously took it remotely. They now require that you take it at a testing location. Okay. Now, if we have enough students who want to, we have partnered with Ponce Health Sciences University, and they will offer it on site in their testing center. But for the most part, our students take it at Prometric. Now, here's layers of this, okay? We request you to be able to take it from NBME, and that takes some time. NBME is not fast at anything.
Yeah.
But you take it at Prometric. And so the goal is you use this exam as an assessment that tells you that you're ready to take the STEP exam. It's got the same content as the material of the STEP exam. It's only 200 questions, not 280, but still it's this very similar content. It also has material on it and exhausting activity that is the same as the STEP 1 exam. And so it's very much a predictability and a predictive assessment to your performance. So if you take it at Prometric, maybe a month before you take your STEP exam, it's going to tell you, oh, your scores are where you're probably going to pass the STEP exam. Or, no, let's not take the STEP exam. We got to do some other things. And it's possible that those other things have nothing to do with your knowledge, but simply have to do with going to Prometric and knowing that that's what it feels like to be there, right? So there's some additional assessments that we can work out for you to take at Prometric. But this is one of them. And so during your prep for STEP 1, we'll suggest that you take additional assessments. NBME, as I mentioned, creates those comprehensive self-assessments, of which currently there are 6 available for purchase. They all have a cost associated with them. So some students decide they and have the resources to be able to take all 6 of them. And some students will work with myself to create other assessments. You can use your QBank, you can use UWorld self-assessments. There are other, AMBOSS offers a self-assessment once a year. USMLE RX has self-assessments. Kaplan has 2 full-length self-assessments, 8-hour self-assessments within their system. So we can work with all kinds of other assessments as well. And to tell you that you're ready for this exam. And once you have hit a place where your scores are at least above the 55% range, so we're kind of getting towards starting to get ready for the exam. Now, I'll explain why I mean 55 in a moment. We then can start to say, okay, let's think about taking the Comprehensive Basic Science exam. Your goal on that Comprehensive Basic Science exam is to get a score that says you are predictably ready for the STEP exam. And predictably ready for the STEP exam, we say approximately 65%. And here's the reason. NBME estimates that passing is somewhere between 60 and 70%. Okay. There is a minimal passing score on the STEP. That's the role of it. Are you ready to go on to what's next? That's the whole purpose of this exam, right? And the pass-fail aspect of it says, are you ready? We ready to go on to what's next? And so we typically see consistently over 65% on multiple assessments and at Prometric. Typically, and we offer remotely proctored opportunities to practice those assessments on your way to Prometric. But that says typically you are ready to go ahead and take the STEP exam. Our biggest pitfalls that students fall into if they do not pass is either A, they did not anticipate that in Prometric, their score was not going to be as high as their previous score, or they feel they need to take the exam because their timeline says they have to, even if they don't have the scores. And so both of those are preventable. Mm-hmm. One is, let's go to Prometric. Let's see what your scores are. Let's take the comprehensive basic science exam there. That's why the requirement is a part of this. Let's get the score that says that you're ready. And if you take it, you do not get a good score, we can absolutely sign you up to take it again. Or we can talk about alternative assessments that you can take at Prometric. And the second is, know that your timelines are malleable, that we can talk about your timelines. If you're on a timeline and you say, oh, I have to take it, but I'm not ready, come to me. Let's talk about it. Let's come up with what are your options? Because I will tell you there are always options.
All right. It's such a big process.
It is. And it's scary, right? Because
scary.
You go to school and you study for this exam. Okay. This exam is this much material. And then even at the end of the semester, okay, so this exam was this much material, times that by 3. Now I have this much material. Okay. But that's one course.
Yeah.
The STEP exam is every single course that you have taken at UMHS pulled together. Right? It's all pulled together. And so in many cases, students think, and this is something we'll see in Maine, it'll start in Maine. Oh, well, I was just studying for that quiz, or I was just studying for that midterm, or I was just studying for that. And we start in the process of Maine of pulling things together. But this isn't an exam that you study for 2 weeks. This is an exam that you constantly have to say, what do I not know? What are the questions I'm not able to answer? What is the piece of this puzzle that I'm missing? Can I not recognize the clinical signs and symptoms? Do I not know enough about the details to differentiate the answer choices? Because those answer choices are not blue, green, dog, cat, ulnar nerve, right? In which case it's
multiples that can be right, but what are they actually looking for?
Yes. And then the last is, do you trust that you know that? And I will say that is the number one struggle of our students. I do not know if it's generational or cultural or what it is, but that's the number one struggle is we have a question, we think we know the answer to it, and all of a sudden the but what ifs creep in. Yep. But what if I don't know enough? But what if it's asking this? But what if it's that? But what if it's this? And for some reason, those but what ifs are very convincing. And it's a transition of a skill to begin to trust that you are capable of doing this. And in truth, all of this is important for what comes next, which is clinical practice under a highly educational environment. But it's still clinical practice. It's still you working with patients. And those patients need you to have gotten to a place where you trust enough. Again, remember, it's minimal passing, minimal competency. We got to get over that. You trust enough that you'll be able to work with them, that they're safe with you. That's why it's pass fail, because to pass the exam says you're ready to go into that room by yourself, gather the signs and symptoms. You know enough, you trust yourself enough to be able to walk out of that door, to participate with the rest of the clinical care team about all of the reasons why and what are we going to do next, right? And in the end analysis, every single one of our UMHS students is here because they believe they can do that. So even though this is a multiple choice exam between you and that, that belief that, yeah, I can do that, that is what's going to get you through this multiple choice exam.
So how does UMHS in the Maine semester prepare students, not just for step 1, but also step 2?
Yeah. So I mentioned a little bit earlier about what step 1 and step 2 are assessing, right?
Yeah.
So step 1 is assessing, can you recognize the clinical signs and symptoms? Do you know the basic science behind it? Step 2, so once you leave Maine, once you go on to your clinical rotations, you work in various different areas of medicine with a clinical care team, and you will have patients yourself that you will gather the signs and symptoms, you will do that history and physical, and you will participate, as I mentioned, with the rest of the clinical care team in order to basically lead the discussion on this patient. Well, what's going to come next after determining and making sure everybody knows the reasons behind is, okay, so we got to run some tests. We're going to go from differential diagnoses to various different, sets of differentials into, we need to come up with a diagnosis, because we're not going to get insurance coverage until we've diagnosed it, until we've determined what comes next. That's the whole next step of clinical care, right? And so with that team, you'll learn, what tests am I going to run? Why am I going to run those tests? What are the results I'm going to anticipate to run with those tests? What's the first step in the clinical care? How do I talk? What do we say to this patient? Do I keep them? Do we admit them? Do they go to, do I bring them back in 6 weeks or 3 weeks or 6 months? What is the layers to this that I'm going to offer? Now you start that process in Maine. So in your standardized patient encounters, you're going to be responsible for the history and physical, right? So that's what we're going to be doing in clinical rotations. But also, you're going to start to think about, in conjunction with the faculty in Maine, what tests might we run? What's my first step of that clinical care? How are we going to care for this patient? So they begin you on that journey. Now, are you going to be an expert and know exactly what tests to run as soon as you start your first clinical rotation? No, you're not expected to be. You're not expected to be. In fact, that's why that's on step 2. That's why you take step 2 after you've done your core rotations, because that's what you learn in your core rotations. But every single patient that you see in your core rotations is going to be a set of signs and symptoms that you're going to gather history and physical from, that you're going to do this interview with, and that you are going to work with the rest of the clinical care team on, what tests are we going to run? What do we anticipate? How are we going to start their clinical care? So if you every day can think about that patient as, well, how would that show up as a standardized exam question?
Oh, yeah.
What would that be? Well, now you're studying for step 2 every single day. Not only are you studying for step 2, you're also studying for your shelf exams, because at the completion of every single one of your core rotations, you are going to take an exam written by NBME that demonstrates that you have learned enough about that specific core or that specific area of medicine that you're ready to be able to continue in that specific area of medicine, right? So you'll take a shelf exam. That's what the NBME shelf exams for every core rotation. Now, your best job from an academic standpoint is to study for those shelf exams like you would be studying for the step exam. Every single one of those questions are the same, very similar to step 2 questions. And the ones that you're going to do in practice from Kaplan, from AMBOSS, from UWorld are the same ones you're going to use in order to study for the step 2 exam. As you get closer to the step 2 exam, you're also going to take practice NBME exams, full-length, comprehensive clinical science self-assessments that prepare you for the step 2. And just like for the step 1, there's a qualifying exam. And for step 2, it's the comprehensive clinical science exam. So step 1 was CBSE. Step 2 is CCSE.
Okay. Now, a lot of students that I've spoken to did not realize that we have NBMEs in our clinical rotations, and that they're only in our core clinicals, correct?
Yes, they're only the cores. And I believe there are 6 cores: internal medicine, pediatrics, psychology, or psychiatry, surgery, and OB-GYN.
Okay.
All of those, you are going to take a shelf exam 2 weeks after the end of that rotation. Yeah.
Okay.
And your grade in your core rotation depends on that it creates a component of the grade to your core rotation. There's a scoring aspect to it, and there is a pass level that we have to reach in order to pass the shelf exam. I believe our current pass rate for shelf exams is 53%. That is always up for evaluation. As we continue to improve as students, we'll probably up that level. But that level is not ready at the point for the step 2. For example, you really want to aim for over 65% on all of your shelf exams, so that you are continuing to be at that level of the preparation for the step 2 exam, similar to what we did for step 1.
All right. So we're kind of going to backtrack a little bit, talking about the main semester, and you've touched on it a bit, but what is involved in ICM2? We've talked a lot about Kaplan. I know we always get a lot of questions about Kaplan, but what is ICM2?
So it is an extension of ICM1 and an extension of physical diagnosis, right? So in the first semester in physical diagnosis, you really start to think about, okay, well, what can we gather from a history and a physical? What can that help to tell us about a patient? And then in ICM1, you go to the level of starting to do that physical exam and starting to hear what you're supposed to hear, feel what you're supposed to feel, go through the steps of making sure that you're interacting with the patient, right? And you do some of that through labs, you do some of that through standardized patient encounters. So ICM2 is an extension of that. You're going to do a standardized patient encounter in every system of the body. You are also expected at this point to have some base knowledge of history. We're going to keep improving upon that. But the ability to differentiate the aspects of what you gather from a patient into a SOAP note, for example, and the clinical representation of how everything fits together with a patient, and then do the physical exam and be able to execute an exam to gather the information from a patient. In that standardized patient encounter, you will not be asked basic science questions. That's for the step exam. However, they are going to start to ask you questions like, well, what might you do with this patient? What do you think about clinical care? What do you think the diagnosis might be? What do you think might be happening here? And so that we're trying to start you on that phase of thinking about what is going to come next. Again, like I said, not an expert in the tests or beginning clinical care, but to begin you on that route to learning all of that information. Okay. And the course incorporates clinical lectures on the systems of the body, with the working with those clinical signs and symptoms in small groups. So you'll practice his physical exam on each other with your classmates, and then you go into the standardized patient encounter. And opposite of that, you'll continue to practice on some clinical skills. Yeah. Can you take blood pressure? Can you put in a central line? Things that are skills that you need to continue to be better at as a clinical caregiver in the field of medicine.
Definitely. So what happens after a student takes step 1?
So after they take step 1, no matter what their score is, they send their score to the registrar's office and to myself. It usually takes 2-ish weeks for your score to come back. There are times of the year where it takes a little bit longer than 2 weeks, but usually about 2 weeks. So I always tell students to plan for something really fun to do in those 2 weeks, because there's literally nothing you can do for UMHS at that moment. But once your score comes back, it's sent to myself and to the registrar's office. If it is a failed score, You will work with me based upon the requirements in order to take the exam again. The institution follows NBME's guidelines that you can have up to 4 attempts at the exam. We don't want you to utilize 4 attempts. Certainly, getting a residency is more difficult the more attempts that you need on the STEP exam, but the institution follows that policy. The requirements that you would need to meet in order to qualify to take it a second, third, or fourth time have all been evaluated and established by the clinical dean. So we follow their guidelines to make sure that we are demonstrating that you're academically ready. But I continue to work with students in that avenue and help them meet those requirements by the clinical deans. If you pass, you are beginning the steps to enter clinical rotations. And there are a number of factors that have to be cleared before you can start your clinical rotations. The first is the registrar's office receives the passing score. Okay, so that's not step number 1. That's why we start there. So they clear you from an academic standpoint. Then the bursar's office has to clear you from a financial standpoint. Okay, you cannot enter clinical rotations if you have a hold from a financial perspective on your account. So you have to have cleared your account from the bursar's perspective. And then the third is from the clinical placement office. And the clinical placement office has a list of documents and evidence of readiness that has to be received. For example, your ACLS certification, things like that. And there's a health assessment form and a document that allows for you to tell the clinical placement office where you'd like to do your clinical rotations, if there's anywhere you will not do your clinical rotations. And all of that has to be received before the clinical placement office will begin to schedule you on your clinical rotations. Okay, so they don't start that when they receive the first document. They need to receive all of the documents and have everything cleared before they will allow for that to occur. And so once all 3 of those are cleared, the clinical placement office will begin to put together a schedule for clinical rotations. That schedule ideally includes core rotations first before we do electives. Sometimes because of your area you want to live in or your area of desire of medicine you really want to go into, an elective rotation may occur earlier in your timeline. But overall, the timeline, they will set up a calendar, a schedule for as many rotations in a row as they possibly can. You may get a schedule from them that doesn't include all of them because they are still working on the others. And they do their absolute best to keep you in one location so you don't have to move around. But overall, they really are setting you up to be able to go from one core rotation to the next.
So how has step 1 changed with step 1 becoming pass fail? Because that's a fairly recent change. And have we made changes in UMHS with the Maine semester and so on because of the new pass fail status?
Yeah. So that's a good question. The exam itself actually didn't change at all. The scoring of the exam only changed in what is reported. Okay, so the scoring, what equates correct, incorrect, what equates a given level of score never changed. So the exam itself has always been 280 questions, not always, but in recent history, has been 280 questions. It has been 7 blocks. It's an 8-hour exam. You're given 45 minutes of break during the exam. And of those 280 questions, there are a significant number of them that are have always and will continue to remain unscored. And part of the reason for that is that the NBME does evaluation of questions before they actually become official, right? So they need to make sure that there's no potential for error with them before they go into this high stakes exam. So the best way to do that is to roll them out. That being said, you used to receive a 3-digit score. The percentage and percentile became a 3-digit score. And the passing score used to be, it increased just about every year. And it used to be the most recent was 194. And just before the exam became pass fail, they indicated that it was moving to 196. And the whole meaning of the passing score being raising up is really to demonstrate that the quality and the percentile that you're comparing to in terms of everyone else who's taking the exam, it's getting more difficult, right? And so that percentile has always been around the 65th percentile.
Okay.
We equate it to a percentage, which is not exactly the same thing, but approximately. Mm-hmm. And so that's why we say consistently over 65% is where you want to be. So have we changed our curricula? Have we changed our approach to the material? No, because there's really no reason to.
Yeah.
What we've changed, though, is the guidance and how to interpret the assessments and the material that you receive, right? Because it used to be, and UWorld still offers a 3-digit score for their self-assessment, that's how you figured out where you were in terms of your academic readiness for the exam. Now, to be honest, I think it's much easier because now we get to deal with percentages. Now you deal with percentages in your QBank performance. You deal with percentages in multiple blocks of QBanks that you might do in an assessment format. You deal with percentages on an NBME practice exam. You deal with percentages on a UWorld practice exam. And so now there's a lot more ability to look at those in equivalence to each other. One additional predictability factor that NBME has offered is on their practice assessments and on the comprehensive basic science self-assessment. They not only give the percentage, or I think they offer it as percentage score, but they also give the percentage of the likelihood that you will pass the exam in 1 week. And in many cases, students focus on that. And part of the reason is the lower percentages, the percentages in like the 50s and 60s, make us really nervous. As medical students, we are supposed to be in the 90s. I don't want to be in the 50s and 60s, right? And so that probability of passing is usually a higher number. And what NBME has found is that if you are consistently at a place where you are over 95% probability of passing in 1 week, you are likely to pass.
Yeah.
So that is what they state is the predictability factor. And I say that because, for example, if your score was 48%, you may have an 80% probability that you'll pass in 1 week. And students get really excited about that. 80%. Would you really go into an exam that is the whole rest of your life with an 80% probability? You may put $1 on the lottery, but not your entire education, right? And so that's part of why we say make sure you are in that over 95% range before you, and consistently, before you take the STEP exam. And that's part of why they say it as well. But those over 65% are over 95%. Like I mentioned, the thing we see for UMHS students is it's that layer of, sorry, those are my dogs. It's the layer of where you take the exam that actually really truly matters. That in the last 3 to 4 years, most of the students, I was going to give a percentage to it, but I don't know the percentage. Most of the students who do not pass the STEP exam, it has to do with the fact that when they went to Prometric, there was an emotionally different experience. Yeah. And that your score never goes up when you're scared. Your score only goes down. So that's one of the best things that you can do is make sure that in that environment, you also know that you're ready for the exam.
Yeah. No, that definitely is huge, having that, not just the right mindset, but the right emotional space.
Yes. Yeah. And part of the reason why it has to be that way, truthfully, is you're going to go to a hospital and you're going to work with patients on a really long day in the most stressful of environments. And we have to be able to be minimally competent in that environment. And that is key.
Yeah. I'm in that space right now, going to be taking step one, hopefully sooner than later, but I've realized my subconscious is, if I don't take the exam, I can't fail. But also, if I don't take the exam, I can't pass it.
Yeah. And there is some safety, I will say. This is a big exam. We've been talking about it for a really long time, right? And I said it's everything that you've studied for the first 2 years of medicine.
Yeah.
But there's also some like comfort in knowing that no student from UMHS who's working with patients will do so until they can prove they're minimally competent.
Yeah.
And that, we're scared of this exam. I get it.
Mm-hmm.
I think we're really much more scared that we're going to fail patients. Okay. And so putting your trust in knowing that you can trust that, well, this is what I think I know. And even though I want to talk myself out of it, even though all the what ifs are telling me, no, if mm-hmm. that's what I know and that's where I can be and that's what I can trust that I know, if I am over that pass rate, these patients will be safe with me. That's what that exam says.
Mm-hmm.
And that's important too.
Yeah, it is. So what are some mistakes you've seen students make while in Maine or UMHS in general before going to step one and onto clinicals?
So the number one reason students don't follow the timeline they want to follow to continue on is distractions. Mm-hmm. Now, that's a big general encompassing reason. Because in sometimes they're wonderful, amazing, fantastic distractions. You get married, you get pregnant, you have a child, you want to spend your time raising that child. Wonderful, amazing distractions. Sometimes they're awful and horrible. Your parents get sick, your grandparents get sick. You are living at home because you can't really afford to live anywhere else. And you have all the layers of expectations to make sure that grandma gets to the grocery store and your mom gets to her appointments. And there isn't a quiet space because it's constantly loud. And the people next door are doing construction and the power's going off every other day. And it's, the fan therefore goes on and off and it's 90 degrees all the time. And all of those things delay the process of getting to where you want to get to. And I mentioned it earlier that we almost kind of live in a UMHS bubble till the end of Maine. And we don't necessarily know that it's a bubble because you're working your tail off and you are dived into doing this. But when you get out of that bubble, everything else starts to happen. Now, there are 2 layers to this. Truthfully, if I could get every single student to live in Maine for 2 semesters, I would. Yeah. Because you could pass that exam by the end of your 2nd semester in Maine without the distraction. Stay in the bubble. Mm-hmm. But when you go onto your clinical rotations, you're going out in the world. Yeah. And yes, you will be busy as can be during your clinical rotations. But as a clinician, you eventually have to figure out how to balance life and who I am as a clinician. Notice I did not say my job because it's not a job. This is a calling. This is who you are as a clinician. And this is who everybody else has grown to know you as you were trying to become a clinician, right? And I don't know the best time for students to do that. And so the worst case is that that's what you do on this extended time, is you figure out how to balance literally everything else. And where are you going to be and who are you going to be? But it does delay the timeline. So the biggest mistakes I see are letting the distractions take over. Mm-hmm. Now, I'm going to push that even into St. Kitts and Maine, because becoming a physician is the most expensive road I know of. And I do not mean the cost of tuition. I mean your sleep, your emotions, your time devoted to this. It is not a job. It is a calling. It is something that you become. And it's hard to be all encompassing in that role. And nobody enters medical school fully ready to do it. Even somebody who has worked in the area and has every experience, maybe they grew up in the family, they've worked in the field, they've done all these things, even that person still doesn't know what it's going to feel like for them. And so those distractions can happen in St. Kitts. Do you want to be a human and go out sometimes? Sure, but there are consequences. Do you want to go scuba diving or snorkeling and not study for your block exam? Sure, but there are consequences. And there are, I don't mean to imply that you have to give up everything that you may be as a human, but the more you can incorporate and live that this and all of this kind of go hand in hand, the more successful you're going to be, because then it's not about, well, I have to study for this. I just want to be done with this. I just want to be done with this. But instead say, this is a part of who I'm growing into. And that's where the success comes from. Any student who says, well, I just want to be done with this, all of this is you as a doctor in training, every single component of it. And you start that process to train to become this person before you arrive at UMHS. But if not before you arrive at UMHS, once you do. And, you know, I mentioned that every patient in your core rotations is signs and symptoms and tests that you might run and can be thought of as a standardized exam question, right? So is every clinical example that was given to you all throughout basic sciences. And if you come into medical school with that knowledge already, then anatomy is not just something I have to know and I have to memorize. No, anatomy is the signs and symptoms of the patients who are presenting with this. And it's not about memorizing the names of the nerves or the names of the vessels, but the patient who has a problem, whose nerve was damaged, leads to these signs and symptoms. You're studying for the step exam right there, right then. And not just the step, but what you're going to do as a clinical rotating student, what you're going to do as a resident, what you're going to do as a clinician in clinical practice.
So
I don't know if that answered that question, but
no,
I hope it did.
It definitely. So we talked about mistakes, but what are some of the greatest choices that you've seen students make that led to their success?
So it's along the same line. Living it. And I don't mean live it like choose, this is who I am, I'm going to do this. But the most successful students have thought about why they're here, have made a conscious decision to say, this is who I am. This is me. I can't change it. This is who I am. And have had to put up boundaries to maintain that. It doesn't come without its boundaries, right? We sometimes have to say, Mom and Dad, I cannot drive grandma every single day to her appointments. In order to get through this exam that I need to take in order to move on to what's next, I need 12 hours a day to do this. That's what I need. Quiet 12 hours. It's not happening at our house, so I'm going to go to the university library every single day. This is what I need. I can't do it doing both. Now, that doesn't mean that that was an easy conversation to have.
No, absolutely
but
not.
it's that layer, and it's that, okay, I can do this. I'm ready to do this. Some students, I'm working a full-time job or I'm working a part-time job because I need to make some money to support my family, pay off some of big portions of my student loans. But because I have to work 4 hours a day, 5 days a week, I'm literally spending every other moment doing practice questions, studying for this exam, getting after what it is that I'm getting after, because that's the time I have. And I can't do it on the other side, but I don't want to do this part-time job for the rest of my life. I want to do this, right? And it is never going to be a field without some layers of disappointment, burnout, exhaustion. Truly, people die no matter what you do. And so the more you can be honest with yourself about A, your limitations, B, what you're feeling, see how you're going to handle those feelings right now from the very beginning. And I do not chastise students who move directly from undergrad to medical school, but the most success I see is when students have a conscious decision and reason to. That can come from undergrad, absolutely. But in many cases, it comes from life. And it comes from saying, oh, okay, well, this is really what I want to do. Yeah. But it also takes a lot of sacrifices. And those sacrifices are real. One of the things I do with students on a daily basis, if I'm seeing a student struggle, is say, you can't do both. You've got to make this decision. I can't make it for you. I can't take this test for you. And I know you're unhappy about this right now. I know you want to get there, but this is what I see. And this is where you need to transition. And this is where you need to switch. And this is what you need to look at. And in many cases, students hear me, but until they can feel it and live it and do it themselves, the change doesn't come.
Yeah.
So my role is to hold up the mirror so a student can see it and create avenues for the students to then be successful and make their way. And sometimes it's the mirror that nobody wants to see.
Absolutely. So that's all the questions I have. But is there anything you want to talk about that are common things students come to you with, or anything else you want to add that we didn't touch on?
The only thing I would say that students come to me with all the time is after step one, I'm going to back that up. After Maine, there's not a campus, there's not a location, there's not oh, these people are right here, I'm just going to go and ask them these questions. Yeah. And there is always questions that we have. Now, sometimes those questions are answered very quickly and the emails are received very quickly, and sometimes they're not. And I do have a lot of students who will come to me and say, I emailed so-and-so and they're not emailing me back. I have a question about this. Who do I go to? I have a question about this. And so in truth, in many times, that's what I do is, oh, yes. So this is the person that you should ask, and maybe perhaps CC this person as well to make sure that that somebody answers your questions, right? And in many cases, it's the team of people who make UMHS run, right? Clinical placement team, registrar's office, the bursar's office, financial aid. All of those are critically important components of your next layer to your education. And they are located in New York, but they're serving 1,000, 1,500 students, right? And so it's hard to make sure that they are, sometimes the way we ask a question too, it's not clear. And so we don't necessarily get the answer that we're looking for because wasn't quite clear. So one of the other things I will say is I'm always happy to help you reinterpret your question and or point you in the direction of whomever might be able to answer that question. I usually don't know the answers to the questions, but I almost always can say, this is the right person to ask. This is the right person to ask, and point you in the right direction. And it can be pretty isolating once you go out into the world of studying and the world of trying to move from one hospital to the next. And so having, you know, a WhatsApp number, which is at the end of my every single one of my emails, that you can send a message to and say, can you tell me what do I do about this? I will not answer it at 2 a.m. But I may not answer it exactly that day if there's too much happening. But it will answer all of your questions, and get you pointed in the right direction.
All right. Well, thank you so much, Molly.
Absolutely.
It's been really nice sitting down, talking to you, and going through all these questions that we've had students come to us with, and that I've heard and I've had myself in the past. So
yeah. Well, and if this creates an avenue for more questions, I'd be happy to answer those as well. And
that'd be great. That'd be great.